Going with the flow, new methods for treating cardiovascular disease. Cardiovascular disease is one of the leading problems worldwide, which includes cardiac diseases, stroke and peripheral circulation disorders. According to the British Heart Foundation, heart and circulatory diseases cause more than a quarter of all deaths in the UK. Around 460 people die each day, and survivors live with serious long-term complications. Serious cause of cardiovascular complications is due to the buildup of fatty plaques, which harden over time inside the artery walls, causing narrowing and decreasing its blood flow. This process is called atherosclerosis, which can occur anywhere in the body. The most common type is the coronary heart disease, sclerosis of coronary arteries. Most common way to treat atherosclerotic plaques is balloon angioplasty, which involves inserting a small deflated balloon attached to a catheter into the atherosclerotic area, inflating the balloon, which breaks up the plaque, increasing diameter and improving its blood flow. To prevent reconstriction, a metal scaffold or stent is inserted, holding the vessel to remain open. Although this procedure is widely used, the metal stents are foreign objects. Human body naturally responds to the foreign substances by rejecting them via inflammatory response. With time, inflammatory tissues builds up around the stent, causing re-narrowing of the artery. This event is called restenosis, which affects 20 to 30% of the patients with serious complications. In some cases it may lead to severe blockage, heart attacks or strokes. For such purpose, various approaches are made to combat these issues but still have limitations, like coating the stents with drugs to suppress immune responses. However, it has been linked to a long-term risk of death due to sudden stent clotting. Dr. York Hsiang, professor of surgery at the University of British Columbia, and his team have been working on new stent devices for the early diagnosis of restenosis. Their recent development of a stent can monitor early signs in the patient with microengineering approaches. In 2018 study, Dr. Hsiang tested a stent to monitor the development of restenosis in real time but in a non-invasive way, smart stent. It is manufactured like a normal stent and can be implanted using standard balloon catheters, composed of pressure sensors joined by a conductive metal frame. The metal part of the stent keeps the vessel open, acts as a miniature antenna that can relay information about the blood pressure, which can be read through the external antennae on the skin, emitting radio waves to provide information. Decreased blood pressure means takes immediate action. The team tested the device in the lab, using salt water in a plastic tube. After acquiring positive results, they tested on an animal model by sewing a graft containing the device into a pig artery, and found that by mechanically restricting blood flow through the artery, they could detect these changes using the antenna. The advantages of this device can deliver real-time information about restenosis without invasive/diagnostic procedures. It can also detect restenosis at an earlier stage, with less danger to the patient. Recent studies have shown that hyperthermia, or mild heat, could be effective for the suppression of restenosis. However, due to invasive methods are used, this poses a risk to patients' health. The smart stent can produce heat when excited with radio frequency waves. This finding led to a very recent study in which led the team towards more promising results. For future studies, Dr. Hsiang will aim to integrate these devices with antithrombotic coatings to enhance its significance. By using microengineering techniques, Dr. Hsiang and his team have provided new diagnostic and treatment techniques for restenosis to improve patients' quality of life.